Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. AD versus ADHD, AD and ADHD are terms used to describe the same disorder. Attention deficit disorder, ADD, is an outdated term, while ADHD or attention deficit hyperactivity disorder is the officially used term. Some people, however, use the term AD interchangeably with ADHD, and others consider AD to be a subtype of ADHD. /r/n/r/n People with ADHD don't always have hyperactivity, but the diagnosis of ADHD still applies. /r/n/r/n Laura Porterrnrn ADHD is the abbreviation for attention deficit hyperactivity disorder. This is the current, official term used to describe a behavioral condition that causes hyperactivity and difficulty paying attention. /r/n/r/n Attention deficit disorder or AD is an older term for the condition. Up until 1987, a person would be diagnosed with AD with or without hyperactivity, which was considered a subtype. The term AD is still sometimes used unofficially. /r/n/r/n The word subtype is no longer used by the Diagnostic and Statistical Manual of Mental Disorders, DSM, for ADHD. Instead, the DSM uses the word presentation to describe the different ways that ADHD may manifest in a person. This means people with ADHD are no longer diagnosed as having a subtype. Instead, they are diagnosed with ADHD and a certain presentation of symptoms. /r/n/r/n The change from subtypes to presentations was made because people can experience a different sets of symptoms as they develop, which fits more with a presentation than a subtype. For example, a child may experience symptoms of hyperactivity and difficulty paying attention during childhood. Then, as a teen or adult, they may no longer experience overactivity. /r/n/r/n ADHD is diagnosed based on the presentations of inattention, hyperactivity, and impulsivity. These presentations have the same names as the former subtypes. /r/n/r/n It is possible to experience symptoms of multiple presentation categories. /r/n/r/n To understand the presentation of ADHD, symptoms are divided into those related to inattention and distractibility and those related to hyperactivity and impulsivity. /r/n/r/n Difficulty with paying attention to detail. /r/n/r/n Difficulty maintaining attention. /r/n/r/n Difficulty listening. /r/n/r/n Challenges with finishing tasks. /r/n/r/n Organization and time management difficulties. /r/n/r/n Tasks involving attention. /r/n/r/n Frequently misplacing or losing objects. /r/n/r/n Distraction challenges. /r/n/r/n Forgetfulness. /r/n/r/n Fidgeting or squirming. /r/n/r/n Difficulty remaining seated. /r/n/r/n Restlessness, running, or climbing when inappropriate. /r/n/r/n Difficulty remaining quiet. /r/n/r/n Being overly active or difficulty remaining still. /r/n/r/n Excessive talking. /r/n/r/n Speaking before listening. /r/n/r/n Having challenges with waiting. /r/n/r/n Frequently interrupting or intruding. /r/n/r/n It is no longer possible to be diagnosed with AD because the term has been replaced with ADHD. Some people may refer to the inattentive presentation of ADHD as AD, but that is not an official term. ADHD cannot be diagnosed with medical testing. Instead, healthcare professionals such as pediatricians, psychiatrists, and psychologists assess the symptoms to diagnose ADHD/R/N/R/N. Depending on the nature of the symptoms, it may be determined that there's a presentation of /R/N/R/N. When diagnosing ADHD, healthcare professionals may consider /R/N/R/N. ADHD is often diagnosed in childhood. Some people outgrow the condition when they reach adulthood, but many don't. /R/N/R/N. Like children with ADHD, adults with ADHD have trouble with focus, planning, and decision-making. If you have ADHD, you may struggle with inattention in the workplace, and you may make what other people describe as careless errors. /R/N/R/N. You may also have trouble listening to what other people are saying, which can lead to difficulty remembering instructions or completing a task correctly. You may have problems staying organized and may lose things like keys and important papers. /R/N/R/N. In adults with ADHD, hyperactivity is less obvious and can manifest as impulsivity. Adults with hyperactive presenting ADHD can be restless, excessively talkative, and have problems with self-control. Sometimes, they engage in risky behaviors such as fast driving, drug and alcohol use, and compulsive shopping. /R/N/R/N. Adult females who have ADHD are also more likely to be diagnosed with the inattentive type, sometimes unofficially called AD. /R/N/R/N. ADHD and AD are both terms used to describe attention deficit hyperactivity disorder. AD is an outdated term that is no longer in official use. Unofficially, however, it is still sometimes used interchangeably with the term ADHD. /R/N/R/N. ADHD has several presentations, predominantly inattentive, predominantly hyperactive, and combined. Some people use the term AD to describe the presentation of predominantly inattentive ADHD. /R/N/R/N. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.